Hello everyone, this is Dr. Lakshmi Kalbande. I am practicing as a consultant obstetrician and gynecologist in Cloud9 Hospitals, Pimple Saudagar, Pune. To answer the question of many anxious parents that, what if we have an abortion or what if we have a miscarriage, what could be the cause of it? So cause of abortions are plenty. The first and foremost being maternal infection, also genetic abnormality in the baby, also any metabolic abnormality in the parents. So for example, if the mother is, diabetic or has a history of thyroid issues, and if the mother's parents or paternal side or maternal side does have a history of metabolic syndromes, that also plays a very huge important role in having a miscarriage. So always get your thyroid profile checked, always get your sugars checked as soon as you come to know that you are pregnant, because those two factors also affect a lot to the growing embryo and to the growing fetus. As far as the genetic abnormalities go, both the wife and the husband, so their genetics do have a large impact on the growing embryo as such. Also, I would say nowadays substance abuse also has a huge impact. So prior to pregnancy or prior to conception, if you were into a habit of smoking or alcohol consumption, so that also does play a very huge important role in having a conception and carrying the pregnancy to term, because most of the times it so happens that because of the substance abuse, whether it be any substance, your body is devoid of all the antioxidants, and there's a lot of oxidative stress that happens in the body, in all the tissues, at a cellular and molecular level, and also at the gamete level. So even if the male partner is having substance abuse issues, so that may also affect his gamete and may result in a genetically faulty embryo, as we say, which fails to implant properly and grow properly and resulting in a miscarriage. So that is also one important reason that it can happen. Secondly, I would also like to tell some precautionary points prior to conception, that you should always visit a gynecologist before you are planning to conceive and get a baseline ultrasound done, because for the female partner, of course, because what that does is, at the baseline ultrasound will tell us about any uterine anomalies that we encounter, any ovarian anomalies, for example, if there is PCOS or if there is any inborn problem in the development of the uterus, which can result in an early miscarriage. So all these problems will be ruled out at least, so that you can start planning for a pregnancy which will eventually be a healthier one and will not result in a miscarriage. Secondly, also metabolic tests should be done prior to pregnancy or prior to conception. Eventually, when you do decide to conceive, you should get your basic complete blood profile, thyroid profile, sugar profile done for both the patients, so that we are at least rest assured that those will not be the cause of abortion later on in pregnancy. So these are the important steps that I think you should follow, especially nowadays that the age of pregnancy or the first pregnancy is quite delayed because of the career problems and all the environmental issues, so as to say. So the more delayed the pregnancy, the more chances there are that there will be some problems encountered during the first trimester, and hence which will result in the first trimester abortions or miscarriages that we say. So it is very imperative for all of us to be prepared for what's to come and just to visit the gynecologist prior to conception.